I woke up this morning and checked the news only to see one of the platforms announcing a big headline that coronavirus cases are rising faster than ever.
Holy shit, we're all gonna die!
Well, for me, that's good news. Where's the problem? But before I explain why it is good news, let me just say that the platform published that number, the new cases, but missed to look at the number right next to it, even though it's right there. The number of fatalities or percentage of cases dying every day, which is also going down quite fast. Now, as a public health specialist, and I said that in another video, I'm only or mainly concerned with the number of deaths in this COVID-19 scenario. And I have been following up that percentage, which has been going down worldwide since April. April 26th was 19%, May 18th, 14%, and June 6th was 11%. For sure, there are the hotspots where fatalities are high, but those areas have already reached their peak. They're now in a plateau phase and will soon start to decline. There might be new hotspots in the future. Back to my point, and I'm a medical doctor, I can tell you that in this specific scenario of COVID-19 or coronavirus, the more cases we have, the better, because it means more immunity among members of the public, at least to an extent. It's like a free vaccine. But here is the catch. It is only good if we keep the fatalities low. The best equation I want to see as a public health specialist in this specific coronavirus scenario until we have a vaccine is more cases and less fatalities. The government who can achieve that is a winner. How to achieve that? Well, we need to redirect all the resources we can and invest it to improve our overwhelmed healthcare systems. Especially low and middle income countries, by the way, they have very weak health systems. Improve the quality and quantity of our health systems component. For example, improve the health service delivery and accessibility. Improve the health care workforce conditions and increase them. Health information systems, medical products, medicines and technologies, ventilators, etc. This is a solid and long-term investment and will sure help in the upcoming pandemics as well. Only then we may achieve a little bit of lower fatalities, as many of the COVID-19 patients may be dying because of problems in all those areas. That's why health systems and hospitals worldwide were overwhelmed. They don't have enough resources. Where do we get the resources to do all that? Well, where did you get the resources to buy billions of dollars worth of COVID-19 tests and machines for the tests? Resources were wasted on testing, tracking, and isolating, which were inadequate in most countries. Very few success stories. Unfortunately, it all started with the recommendations of the World Health Organization to test, trace, isolate, which may be effective, of course, for diseases, for example, like Ebola or SARS. But for this specific coronavirus, what have been the results so far? 5 months into the pandemic, most countries, even the developed ones, have admitted that the contact tracing hasn't been an easy task, that they cannot do enough testing. And what kind of isolation are you talking about? Because most people were already under lockdown during the past months. Huge resources, time, personnel, information systems were wasted. Let it be with good intentions on mass testing, contact tracing, and isolation that only worked for very few countries that have either low populations and countries that started really early, like they started in January. What about mass testing? Well, a few days ago, the President of the United States announced that 20 million COVID-19 tests were done in the past few months. Well, 20 million out of 330 million population of the United States. How adequate is that for mass testing? You think that's a good investment? And by the way, 20 million tests doesn't really mean 20 million people were tested, because as you may know, every case may take somewhere between 2 to 6 tests over the duration of the disease till recovery. For example, you need 2 negative tests to be released from the hospital. The United States is a big economy though, and maybe they have extra resources. But if you are a developing country and have limited resources, you need to make choices. Should I spend on testing kits, testing machines, isolation, contact tracing, and try to count cases that will never be properly counted? Or should I invest those huge resources to strengthen my healthcare system and minimize fatalities? I would choose to do all I can to minimize fatalities without any second thoughts. It is unjustified that till now many countries, especially the low and middle income ones with limited resources, are still trying to follow the test, trace, isolate. This is the mentality of Ebola and SARS. Unfortunately, it may not be as effective in the case of COVID-19. More research will be needed in this area for sure. Once more, a high number of cases, even though is not a reliable indicator, is good news only if you can invest enough to keep your fatalities to a minimum. Thank you.